Hello, everyone. I'm Tatiana Glebova, a distinguished professor in couple and family therapy program at Alliant International University.
And I'm Arpita, assistant professor in the marriage and family therapy program at Central Connecticut State University.
I'm Rashmi Gangamma, associate professor and program director of the master's program in CFT at CU Denver.
We are the authors of an article published in Family Process and titled Relational Ethics in Immigrant Families, the Contextual Therapy Five-Dimensional Framework. Contextual family therapy, originally developed by Ivan Basarmini and Nad, offers a unique approach to clinical work with immigrant families. And it addresses complex transgenerational processes in families who experienced cumulative traumas. Like many other approaches, contextual therapy posits an importance of trust and safety in family relationships, but it also brings a unique focus to very important processes of social and relational justice and injustice, loyalty, parentification, and entitlement. And those aspects are often overlooked in other theories in clinical practice. While this approach is very useful, many family therapists find challenging to utilize it effectively. Since we all are family therapy educators and supervisors, we want to introduce this model and conceptualization with a real-life clinical example.
We talk about John, a cisgender male in his 30s who sought therapy for his depressive symptoms and difficulties with self-identity. John was born in the United States several years after his mother's arduous immigration to the United States from an Asian country with a history of severe socio-political turbulence. Upon immigrating to the United States, she faced isolation, discrimination, and had to go through multiple hurdles to obtain her legal status. She was alone navigating a foreign world and working hard to provide for her two sons, who were both able to graduate from college, her own unrealized dream. Growing up, John got into frequent arguments with his mother. His mother was frugal and wanted him to be hardworking and driven just like her. In his own words, it was unfair. John reported that his mother lacked empathy for her children and felt entitled to be the main focus in any situation. Years ago, John's therapist had told him that his mother was a narcissist. It is possible that John's mother might have a narcissistic personality, given the known associations between these traits and childhood traumas. However, labeling her as a toxic person who should be cut off did not help him much. He wanted to stay connected and understand her better, since he was aware that some of his behaviors resembled hers. This became even more important for him once he became a parent.
Later, John's contextual therapist explored his mother's side after acknowledging John's own struggles. Just the act of acknowledging that parents may have struggled with injustices, which may have then influenced them to treat their children harshly, can already bring changes. John was able to see his mother as another human being who also was a victim of injustice, thus starting the process known in contextual therapy as exoneration. According to contextual therapy, cutting off his mother as a toxic person would not help John to become happier or freer, but would burden him more with guilt and a sense of indebtedness. John probably had an intuitive sense of that when he was bringing his relationship with his mother into sessions. The change in John's perspective of his mother helped not only to stimulate direct expressions of mutual caring, it also reinvigorated John's mother's involvement in caring for John's child, her grandson. Activation of these unutilized inclinations to give in family relationships is an essential method of the contextual approach for strengthening relational and individual resources.
So we hope that this real practice case made you interested in reading the whole article. We provide support of our conceptualization using existing non-contextual therapy research. And also at the end of our paper, we discuss very specific, concrete, practical recommendations for working with transgenerational issues in immigrant families, first and further generations. And we would love to hear from you, your thoughts, your feedback. So if you have any questions, any comments, please contact me via email Glebova @aligned.edu. Thank you very much for your attention, and we hope to hear from you.